Hi, are your periods coming too frequently, lasting too long, or bleeding excessively, or coming even after menopause? If yes, then you may be having something called abnormal uterine bleeding. Most of the women ignore these symptoms, considering them to be normal part of life. But some of these things can indicate a health condition that might need medical attention. Hi, I'm Dr. Aboli Chandge, Senior Consultant, Momstory. Today we are going to discuss what is abnormal uterine bleeding, what are the common causes of it, when to consult a doctor, and what are the possible treatment options. So let's begin. Abnormal uterine bleeding. So normally the menstrual cycle occurs every 21 to 35 days, where the bleeding lasts between 2 days to 7 days with the moderate amount of blood loss. So we call it abnormal uterine bleeding when your normal pattern of cycle is disturbed. Like when the periods are too heavy, or the bleeding is prolonged lasting for more than 7 days, or if you are having bleeding in between periods, that is intermenstrual bleeding, or if the bleeding is happening after menopause, bleeding after intercourse, or frequent periods that occur less than 21 days apart, or infrequent periods that occur more than 35 days apart. So if you are having any of these symptoms, it is better to visit a gynecologist and get yourself evaluated. Now, what are the causes of abnormal uterine bleeding? Hormonal imbalance. This is the most common cause of AUB. Estrogen and progesterone are the two important hormones which help in maintaining and regulating your menstrual cycle. Any imbalance in these hormones can lead to excessive, heavy, and prolonged bleeding. So, such cases can be seen most commonly in adults in age group immediately after menarche, or in women approaching menopause, or in women with irregular ovulation. Secondly, PCOS, which is recently renamed as PMOS. In women with PCOS, ovulation may not happen regularly. And because of this, the inner lining of uterus will get building up and will lead to irregular shedding. This can lead to heavy, prolonged, and irregular bleeding. Fibroids. Now, fibroids is a growth which is non-cancerous that occurs inside the uterus. Now, depending on the size and location of the fibroid, the symptoms can vary. The fibroids causing abnormal uterine bleeding can lead to heavy bleeding, prolonged cycles, pelvic pressure, and symptoms of anemia. Then adenomyosis. In adenomyosis, the tissue lining the inner lining of uterus start growing inside the muscle wall of uterus, and that can lead to heavy flow during periods, severe cramps, and enlarged uterus. Thyroid issue like hypothyroidism, hyperthyroidism, both can cause irregularity in period that leads to irregular heavy periods and prolonged cycles. Endometrial polyps. So polyps are the growths that occur inside the uterine cavity. Presence of endometrial polyps can lead to heavy bleeding, spotting in between periods, and bleeding after intercourse. Then abnormal uterine bleeding can also be associated with pregnancy. Any bleeding that occurs during pregnancy should always be investigated. So causes can be threatened miscarriage, ectopic pregnancy, or issues related to placentation. So anyone, if they are having bleeding during pregnancy, it is must that you visit your gynecologist. Apart from that, endometrial hyperplasia and endometrial cancer. Though less common, but they are very important causes of abnormal uterine bleeding. Such cases should be taken more carefully in women who are having abnormal uterine bleeding with the age above 45 years, women with obesity, women with history of PCOD, and women experiencing bleeding after menopause. Then one of the important cause is bleeding associated with certain medications and hormones. So if someone is on any treatment, hormonal treatment or certain blood thinning medications, that can also lead to heavy bleeding during periods. So these are some of the causes of abnormal uterine bleeding. Now, when to consult a doctor? If you are experiencing any irregularity in your menstrual cycle, the pattern is disturbed, like heavy flow, bleeding lasting more than 7 days, bleeding occurring in between your menstrual cycles, bleeding occurring after menopause, or bleeding after intercourse. So, in such cases, it is important you go and visit a gynecologist and get yourself evaluated. When you visit a doctor, the focus will be on detailed menstrual history and your physical examination. Also, some investigations can be done, that is, blood test, including your hemoglobin level and your thyroid profile. Also, pelvic ultrasound is important, which can suggest the diagnosis of fibroid, adenomyosis, or endometrial polyps. Pap smear is an important test in the patients where it is indicated. Endometrial biopsy is also an important test to rule out endometrial hyperplasia or cancer. The treatment options depend on the cause of abnormal uterine bleeding, and the treatment mostly is very effective. The treatment consists of medication, minimally invasive procedures, and surgical treatment. In medication, we can give medications to reduce the amount of bleeding, hormonal treatment, progesterone therapy, oral contraceptive pills, and iron tablets to treat anemia. In minimally invasive procedures that include polyp removal, hysteroscopy, and endometrial biopsy. The patients with large fibroids, adenomyosis, or persistent symptoms in spite of taking medical management might need surgical treatment. So, abnormal uterine bleeding is not a diagnosis in itself. It is a symptom that can indicate a serious concern which might need immediate attention. So, if you are having any of the symptoms of abnormal uterine bleeding, do not ignore that and visit your gynecologist for early diagnosis and treatment. Thank you. For more information, visit Momstory.